State Youth Soccer Association is now partnering with MedStar Sports Medicine, making sure that our young athletes have access to doctors within 24 to 48 hours of injury. Well, this morning we have Dr. Frank Dawson with MedStar Sports Medicine Partnership here to explain, here to weigh in on exactly how this can help our families if and when we should need it. Thank you so much for being here.
Thank you for having me.
So let's talk about this partnership. How is this different from the care that's already being offered?
It's an excellent partnership for the athletes involved because it allows their parents and coaches to notify MedStar and get them into our office within 1 to 2 days. That way their injury can be evaluated promptly and get them to the necessary specialist.
What are the types of injuries that you're seeing from young athletes?
In soccer particularly, one of the most concerning is concussions. It's very, very important to make sure that if your child had any symptoms of concussion from a prior season, that all those issues are resolved before they start their new spring sports season. And then also lower extremity injuries in soccer are very common. Knees and ankles are very common injuries in both boys and girls.
I think some parents, especially new parents, I'll point to myself, you're scared to let your kids go out and do this because you don't want them to get hurt. What age, though, is it good for them to get out there and start moving and participating?
It's good to be active as early as possible. So if you can get your child out there playing soccer 4, 5, 6 years old, there's absolutely nothing wrong with that. But you have to remember there has to be a balance. Kids need some recovery time to avoid overuse injuries.
And how do you know how do you know how serious the injury is? If you're a parent, you know, can you trust your kid when they're crying, when they're not? You know, when do you need to go to the doctor, I guess is my question for you.
That's a great question. If you're concerned with a head injury, you should always present if you have any concerns at all. And the concerning symptoms of concussion would be headache, dizziness, confusion, any sort of vision disturbance. So if you had a child who had a suspected head injury and you get home and see any of those things at all, you certainly want to call your healthcare provider or present to emergency care.
And especially with this new partnership, that should make things even easier.
Absolutely. The Maryland State Youth Soccer Association has a dedicated 1-800 line that they can contact, and any patient who has an immediate problem can contact us at our 1-800 MedStar Sports line. So we're always here to answer any questions.
And that's good for the entire state of Maryland, am I correct?
Absolutely.
Okay, so that's all of our viewers out there watching. They can take advantage of this to make sure their kid gets what they need.
Absolutely.
Any other tips or advice that you have for parents?
It's really important to make sure that your child comes into a new season rested. If they're coming straight off of another season, you might want to give them 1 to 2 weeks off to avoid overuse injuries. You want to make sure that if they're at risk for any particular problems, they've trained and rehabbed those, so they start at a good baseline.
That's great advice. Dr. Dawson, thank you so much for coming in. We appreciate it.
Thank you.
Well, it is